We're moving to our fourth sphere. Thank you, Gidi. Sorry, thank you. We're moving to our fourth sphere, which is the modern plagues of these days. And I'm honored to have with us here Cote, who's a former NHL hockey athlete, to share his personal perspective and painful familiarity with this topic of opioids. Riley? Oh, hi.
Morning, guys. It's an honor to be here. Unbelievable event, and also to be addressing a very important issue that's plagued this planet. I played 8 years of professional hockey, and I've seen the darkness within the sports world that the opioid crisis has really brought upon us. And it's no joke. Opioid addiction does not discriminate. Doesn't matter who you are, how much money you have in the bank account, race or creed. This is a very real issue. And I back in the US, I'm on the forefront in a group called Athletes for Care that's really addressing the opioid crisis in a direct level. The solution, in my opinion, is cannabis. The root cause of the opioid crisis is cannabis prohibition. And the sooner we realize this, the sooner we can have, or at least begin to address this thing on a very granular level to encompass the planet that has been plagued. There's so much that goes into this, and there's so much misinformation. And the cannabis issue haven't really scratched the surface of what it can do, but it's proven throughout history to be an unbelievable tool to manage pain. So it's important for us to get back to basics and really study the cannabis plant and these cannabinoids as a sustainable tool to manage pain. Because we've hit the bullseye on the wrong target, in my opinion. So we need to get back to basics, we need to come together, and if we want to be on the right side of history, we need to focus on the cannabis plant as a solution to this opioid crisis, because it is very real. Again, I've seen it firsthand, and it is destructive. So I thank you guys today for being here. Everyone's here for a different reason. I appreciate the platform. And again, together, if we want to be on the right side of history, we need to address this thing together. Thank you.
Thank you, Riley. You can look at the opioid crisis from a personal perspective, and you can look at it more from a technology perspective and a structure perspective. And I'm glad to have Dr. Gidi Stein with us to share what MedAware does in the context of the opioid crisis. Thank you, Gidi.
Good morning. Doesn't seem to work. Never mind. Let's try it like this. Oh, now it works. Technology. Corey was only 19 when he had an accident involving a snowboard and a trampoline. That's his picture out there. He suffered from multiple fractures in his shoulder and arm, and was prescribed with opiates to treat the intense pain. But within a few months, he became dependent on these opioids, even after the pain was gone. But then it was too late. And a few years later, and after multiple rehabilitation attempts, Corey was found dead from opioid overdose. And Corey's story is just one of 50,000 annual casualties from the prescription opioid epidemic in the United States. 50,000 patients. Unbelievable number. And although opioids medications are important and help many patients, over the years, overprescribing and misprescribing has led to one of the deadliest epidemics in US history. And we now know that early identification of patients that are at risk of becoming addicts and dependent down the line is key to battle this epidemic. At MedAware, our patient safety platform uses artificial intelligence to continuously monitor the patient records to identify medication-related risks, such as prescription errors adverse drug events, involving contraindications, and stopping them at the point of care, essentially saving lives. But we also continuously monitor opioid prescribing and usage habits to help identify patients who are at risk of opioid dependency down the line. And by using our technology, physicians now have the ability to intervene and prevent their own patients from becoming dependent and later addicted to opioid medications. And 2,000 years ago, Hippocrates says, "Primum non nocere," first do no harm. Are we doing enough? Thank you.
Much, Gidi. It is my pleasure to invite on stage, finally, two ladies, super impressive ladies, to join us to discuss how a hopeful collaboration can potentially improve the lives of millions of cancer patients. We have with us Cathie Reid from Icon Group in Australia. Great to have you here. And Chanan, the CEO of Sweetch. Great to have you here.
Thank you very much, everyone. The world is facing an incredible burden of cancer. In 2018 alone, there were more than 17 million new patients diagnosed with cancer, and more than 9.5 million patients lost their lives to cancer just in that 1 year. But staggering as those numbers are, it's only forecast to get worse, and those numbers are set to grow. India, China, and the Asian region is going to contribute nearly half of those new numbers of patients diagnosed with this terrible disease. At Icon, what we're trying to do is help to alleviate that burden of disease. Icon is Australia's largest provider of integrated cancer services, and through our operations in Australia and Southeast Asia, we're currently providing care to more than 2 million cancer patients each year. That's a number that we expect to double as we increase our reach now into mainland China. Our mission at Icon is to deliver the best care possible to as many people as possible, as close to where they live as possible. But the reality is, you can't always build a cancer centre right next door to somebody's home. So one of the things that we've been exploring opportunities, though, is the mobile devices that we all carry in the palm of our hands allow us to reach people within their homes and extend that potential to be able to impact on their health. We've been exploring the opportunities that this presents and thinking about how we can actually work using mobile technology to improve the lives of cancer patients. One of the key opportunities that we've identified is the increasing body of evidence illustrating the positive impact that exercise can make, both during and post-treatment. And mobile devices allow us to deliver that benefit to patients right within their homes. Now, last year, Stuart and I were fortunate enough to be part of the Cure delegation at the OurCrowd Summit. And Yossi and Alan took us with them to meet the Israeli Prime Minister to hear about the commitment that Israel is making to digital health and utilising technology to improve those health outcomes. Further to that, we spent time with Alan and Yossi talking about what we wanted to achieve at Icon and what some of the challenges were that we were facing. And from there, they introduced us to Dana.
Thank you, Cathie. Sweetch is an AI platform that improves clinical outcome and prevent diseases like diabetes, IBD, obesity, etc. And now we are approaching the oncology domain by promoting different areas of health, increased physical activity, weight loss, diet and nutrition, medications, etc. Right, didn't move. Sorry. In order to ensure patient adherence, Sweetch personal behavioral AI utilized automatically, based on each patient's life habits, different tools like responsive messaging, gamifications, social tools, etc. Each is being delivered to the patients based on their progress in the program and level of adherence. The way that it works is the data is being collected seamlessly from the mobile devices to enable Sweetch AI to promote the smartest recommendations at the right time and in the right place that the patient is most likely to adhere to.
Now, Dana and I only met in person for the very first time yesterday, but using the power of technology, we've actually been working together for some months to collaborate on the way that Sweetch can actually develop an exercise program for breast cancer patients, so we can deliver that solution into people's homes, potentially impacting on the millions and millions of patients who are diagnosed with cancer and making a positive impact on their lives. It's an opportunity we're incredibly excited about and very appreciative of OurCrowd for the chance to bring us together to do that. Thank you.
Thank you, Cathie. Thank you all.
Thank you very much, Cathie. Thank you. We've just heard from 7 startups with incredible technologies. We're proud to be instrumental in helping the companies grow and achieving their success. All these companies demonstrate the 2 lines that we're looking for, the global impact and the financial returns. You can see these companies and more impactful companies throughout the day on this stage and in Bnei Uma. Glad to have you here, and thank you very much.